I'm Elliott Danker from Power 98, and today joining me is Dr. Jeffrey Loh. He is a senior consultant at the National University Cancer Institute Singapore and National University Hospital, as well as an associate professor at the NUS Yong Lu Lin School of Medicine. Welcome, Doctor.
Thank you.
This week we are talking about cervical cancer. This is an interesting one. What exactly is cervical cancer and who's at risk to this?
Cervical cancer is basically cancer that arises from the cervix, which is located at the top of the vagina and also leads into the cavity of the uterus, which is the womb. The cells at the cervix, when they are infected with human papilloma virus, can then be at risk of developing cancerous change. So any woman who has ever been sexually active or who has ever had sex before would be at risk of cervical cancer, because the human papilloma virus is now known to be the key cause of all cervical cancer. So 99.9% of cervical cancers today, we understand, are caused by high-risk types of human papilloma virus. So if a woman has never had sex before, then she will almost certainly never develop cervical cancer.
So there are no other risk factors?
Yes, the risk factors can be easily understood with an analogy, what we like to call the seed and the soil theory. So if you imagine the cervix to be the soil or the ground and the human papilloma virus to be the seed, then what we know is that if you throw a seed on the ground or any piece of soil, the chances are that the seed will germinate and grow into a plant, provided there are growth factors. Cofactors such as sunlight, carbon dioxide, mineral, salts, water, sunshine, and so on. So the seed is important, because without the seed, you'll never get a plant. But without the cofactors, the seed will not germinate. Right? Okay, so the analogy of the seed and soil theory is that the human papilloma virus is like the seed that lands on the soil, which is the part of the cervix, which is what we call the transformation zone. The cofactors that cause the human papilloma virus to then initiate cancerous change on the cervix would be factors that either reduce the immune system of the woman, or those that increase the amount of transformation zone on the cervix itself. So factors such as smoking, for example, which are well known to affect the immune system. Other factors such as sexually transmitted diseases like syphilis or other types of sexually transmitted conditions like gonorrhea, for example, and especially conditions like the human immunodeficiency virus, HIV/AIDS, certainly will reduce the immune system and make the woman more susceptible to changes of the cervix that will lead on to cancer. The normal human immune system is such that after a few years of being infected with the human papilloma virus, the healthy immune system can actually clear the virus spontaneously without needing any specific treatment. So having multiple sexual partners, for example, or for a woman who starts to have sexual intercourse at an early age, particularly before the age of 18, and even if a woman has one single partner, but if that partner has got multiple sexual partners himself, then this puts the woman at risk also of developing cervical cancer. So this is the play between the key factor, the human papilloma virus, and multiple cofactors that are closely related to lifestyle that can increase a woman's susceptibility to developing cervical cancer. So having human papilloma virus infection per se is actually a very common phenomenon. So it is the other cofactors that will then decide who are the people who are unable to clear the virus, for example, or maybe more susceptible to the virus causing cancerous change in the cervix. So what we would say is that having human papilloma virus infection is actually a very common occurrence, but having the virus cause cancerous change is actually quite an uncommon occurrence, almost sort of the tip of the pyramid versus the base of the pyramid.
What about symptoms? What should a woman look out for then?
Okay, symptoms are actually quite uncommon in the very early phases of the cancerous change. It is now very well known that the initial phases are actually pre-cancerous change. So the initial changes in the cells are actually pre-cancerous, and these are very silent. They don't cause any symptoms whatsoever. There's no change in the discharge pattern, there's no change in bleeding or menstrual pattern. By the time it develops into an actual tumor on the cervix, then one of the common symptoms would be what we call postcoital bleeding, which is the medical term for bleeding after sexual intercourse. In the more advanced stages of the disease, when the cancer spreads to the bladder, spreads to the bowel or to the bone or to the nerves, then the tumor will be quite large and can produce a foul-smelling, blood-stained vaginal discharge, can cause bone pain, blood in the urine, blood in the stools, or very severe pelvic pain. So those tend to be symptoms related to more advanced stage of disease. But in the early phases, in the precancerous phase, we always advise screening with pap smears, which will be able to pick up the silent precancerous phase of the disease, which is much easier to treat, and then arrest it from turning cancerous.
Out of curiosity, with this condition, is it a possibility that it would be age-related perhaps?
It tends to occur more in the women who are in their late 40s, in their mid-50s, and perhaps in the 60s. That is usually the peak occurrence. We do see a group of younger women in their mid-30s to the mid-40s who develop slightly more aggressive forms of cervical cancer. But the more common types of cervical cancer tend to occur in the middle part of their life, in the mid-50s.
And
around the age group.
What can a woman do to get screening for cervical cancer, or how often should she get it done?
Yeah, the primary prevention actually quite established now is actually using the human papilloma virus vaccine, what we call a HPV vaccine.
Okay.
Because if you can protect yourself against the two main types of HPV, then you basically give yourself fairly good protection against most types of cervical cancer. For screening with pap smears, this should be done from the age of 25. This is already very well established in most of the Western countries, like in the UK, Australia, and the United States and Northern Europe, that regular pap smears are definitely very effective in reducing the incidence of cervical cancer and death from cervical cancer. So I would advise that all women who have ever had sex from the age of 25 should begin pap smear screening at least every 3 years, if not better still every year. Once they reach the age of 30, we now advise not only pap smears but the addition of HPV testing as well. That is where the doctor, besides removing some cells with a brush for pap smear, would also send some of the brushings to test for the presence of human papilloma virus as well. So this has been found, particularly in women aged 30 and above, to be much more sensitive in detecting human papilloma virus. And if both the pap smear and the HPV test are negative, to be of a much better negative predictive value, meaning that it gives you a much better peace of mind, and you can actually have this combination test every 5 years. So this would be something that should be done until the age of around 65 to 70 on a regular basis.
That's great, Doctor. Thank you so much for your time. And thanks a lot for joining us on our series of regular health issues. To find out more, make sure you check back on the Facebook page. It is, of course, the National University of Singapore's Yong Lin School of Medicine.
Love life, love music.
Power 98.